Hey everybody. So last time we met, we talked about all the different types of migraine symptoms as well as what causes migraine. Today, we're going to talk about differential diagnosis of migraine, which means going through all the different symptoms that you can experience and determining if it really is a migraine that you're dealing with or if it's some other problem happening within your body. Migraine symptoms cover the whole gamut of systems in our body, so oftentimes we might have more than one problem happening at a time, or it might just be your migraine, or it could be something completely different. It's really important that if you think that you're dealing with a migraine or another issue in your body, that you work with your doctor and other healthcare providers to work through your symptoms and figure out exactly what the cause of them are. There are different types of migraines as well, and those include migraine without aura. This is the most common type of migraine. Migraine with aura, abdominal migraine, ocular migraine, vestibular migraines, migraines with aura only, basilar migraines, and chronic migraines. Now, it's important to note that migraine with aura only does not involve any type of head pain whatsoever. So this makes things really difficult to diagnose because it doesn't have the traditional head pain that we commonly would associate with a migraine. Also, chronic migraines are ones that occur 15 or more days per month for 3 or more months at a time. Migraines will typically follow some type of pattern. And usually there are some warning signs that you're going to be developing your head pain, such as fatigue and food cravings. And then after that, if you do have migraine with aura, that is when those symptoms occur. So you get peripheral vision changes, kind of flashing lights or blurred lines, and that lasts up to about an hour, and then that's followed by head pain, and the head pain and other migraine symptoms will last anywhere from the 4 to 72 hours that we discussed earlier. Then those symptoms resolve and go away, and then you're left with kind of feeling weak and fatigued and just kind of crummy for a day or two. That's considered part of that migraine cycle. So sometimes the diagnosis of migraine is simply by process of elimination, and trying a migraine medicine, if that helps your symptoms, then we know that you're dealing with a migraine. If not, then we need to look at all the different symptoms that you're having and determine what's causing them. So migraines have a lot of neurological symptoms, and those can often mimic a brain lesion or a tumor, seizure disorders, a stroke or concussion, meningitis or other infection, bleeding in the brain, aneurysm, vestibular neuritis or labyrinthitis, and changes in blood pressure. So tests that your doctor might do is obviously checking your blood pressure, going over any labs that might be important at that time, and sometimes a brain MRI or CAT scan may be indicated to rule out any of those problems as well. You also have visual changes and sometimes even periods of blackouts with migraine, and so we need to rule out ocular dysfunction as well. Those problems might be things like diabetic retinopathy, a brain tumor, stroke, or a seizure disorder. So it's important to work with your physician and your eye doctor to make sure that there isn't any problem happening within the eye itself. There's also gastrointestinal disruption with migraine, the nausea and vomiting and all that good stuff. And so other problems that would go along with that and mimic those symptoms would be things like diverticulitis, an ulcer, and irritable bowel syndrome. So sometimes just a trial with your doctor of different meds to manage those symptoms and further diagnostic testing such as an abdominal CAT scan or ultrasound, even an endoscopy or colonoscopy would help to rule out any of those symptoms as being part of your migraines altogether. Also, there are other types of headaches too, and those are often misdiagnosed as migraine, particularly sinus headaches, as well as tension headaches and cluster headaches. So you might think that you have a migraine, but you're really dealing with another type of headache, or you might have two different types of headaches happening at the same time or on alternating days. So it's weeding through all those problems to figure out what's going on. There are occasions when head pain should be considered an emergency, and this would require a 911 phone call, a trip to the emergency room, or contacting your doctor right away. Headaches should be considered an emergency when you're experiencing the worst head pain of your life, if your headaches go for days with no relief, if they're accompanied by a fever, or if they're following an injury to your head or neck, if there's a presence of other neurologic symptoms such as facial droop, paralysis, or weakness on one side of the body or both sides of the body, or anytime your symptoms according to you are different than anything that you normally experience. So anything outside of the norm for what your migraines usually are should be considered an emergency, and you should be getting in touch with your doctor. So this was the whole Google search, WebMD search of why you shouldn't Google your symptoms, but it is important to go over other things that can cause similar problems that you might experience while you're dealing with your migraines. Next time, we're going to talk about things that you can do to be a little bit more proactive in the management of your migraines. So get ready to take action next time, and I'll see you then. If you